Absolutely. So, we call it myopia. Short-sighted in America, they tend to call it nearsightedness, and the name gets confusing. People confuse short sight and long sight, and that's where it's nice to have the actual proper label out there, starting to become part of more of the common language. And so, we are generally not born with myopia. We are generally born more on the hyperopic or long-sighted end. And myopia is something that increases in prevalence at around school age. So the number of people who become myopic, it becomes a lot more. So the whole average prescription sort of starts to lean towards that short-sightedness. And often the first conscious signs of being short-sighted is you start not being able to see as clearly in the distance. And it could be that you know the things are blurry, or it could be that the person next to you is laughing at a sticker on the back of a car and you can't see it. That's what happened to me. But you were sort of unaware of it because it sort of crept up on you. And it used to be a thing that, when I started in the profession, that, if I had a young person in my chair who was short-sighted, I could almost guarantee that the parents were short-sighted. Whereas now I think they're predicting the Brian Holden Vision Institute looking at some of the statistics, and they were looking at 50% of the world's population being short-sighted by 2050. And if you have a look at the American story, back in the early 70s, there was about a third of the population were short-sighted. They're now up to 60%. We're kind of sitting in Australia where America was back in the 70s, where we're about a third, but they're predicting that we'll kind of hit that 50% mark down the track as well if things keep continuing. And you kind of go, well, where's this all coming from? And I'm certainly getting parents in now with bringing their kids in who are becoming short-sighted, and there is no family history. So something's shifted. Obviously, you can have genetics, but they talk about nature versus nurture. Nature being you picked the wrong parents, nurture being what are you doing with your eyes where they change. And so short-sightedness has been linked to a lot more indoor time versus outdoor time, intensity of near work. We have a look at why has Australia escaped it for so long? Well, we've got an outdoor lifestyle. We've got more access to greenery, less built environments. But we certainly still got that pressure with devices. And so when you become short-sighted, the eyeball starts to grow longer than it should, and that throws the optical components out. So it maintains near vision, but you start to lose clarity in the distance. And if you go and get a correction done to restore how clearly you're seeing out in the distance, that does nothing to stop that process of the eye getting longer. Now, if the eye is getting longer than it should, then it's going to start to create sort of stretching and other things in the eye tissue itself. And so the concern is if it's allowed to get to a very high level of eye length and therefore high level of myopia, that you have a higher risk of other eye diseases as an adult. So things like glaucoma, where the pressure goes up in the eye and damages your nerves. You've got risks of retinal detachments. And you've got a higher risk of getting cataracts earlier than other people. For very high short-sightedness and myopia, you've got the macular degeneration. So we're looking at improving the outcomes for kids for the decades to come in their adult life. So that's that early intervention.
Right. So myopia leads to not just short-sightedness or nearsightedness now, but you might be setting some time bombs for like decades in the future when
Absolutely,
when
yeah,
these types of eye health things actually come to fruition.
Yeah, it's not just the inconvenience of not being able to see. Yeah,
Yeah,
absolutely. Yeah, yeah. And
so
there are things we can do about it.
Right. Well, let's talk about those. So, like, what are some of the treatments available for myopia? And is it possible to actually stop myopia, or is it possible to slow it down? And like, what are some of the treatments that you found are really effective for doing that?
Yeah, so there's a lot of research in myopia, and with any sort of research, it's very difficult to say something. You got to be careful saying something causes something else, and you have to have a huge amount of research to be able to get a direct causal link rather than just saying something's kind of associated. But they now are brave enough to say that lack of daily outdoor exposure is a cause of my early myopia development. And so one of the things that I'm coaching my parents on, particularly if there's a family history, if they're worried about what their kids are doing with screens and indoor time, is that you need to be spending 90 minutes per day or more outside. Now, that doesn't mean you won't become short-sighted or myopic, but it delays the onset, because the older you are when you start becoming short-sighted, the slower the progress tends to go, the less myopic you'll be as an adult. And so lifestyle choices are a big one that I don't think we talk about enough. Limiting taking breaks from near work, 45 minutes is kind of a maximum. Hop up, move around for 5 or 10 minutes. Don't move from one screen to another one. Don't move from a book to then the phone. Get up and move, and preferably outside. If we get to the stage where the horse is bolted, as the cliche goes, that we've already started the path of being myopic, then we can use different optical tools to inhibit that growth and inhibit that process. So one of the leading techniques we have is the ortho-K or orthokeratology. We also have multifocal soft contact lenses. We now have new spectacle technology, and there's also some drug therapies that help with trying to slow down the growth. Now, we can't stop it necessarily. The indications are that, it depends on which bit of research you look at, but anywhere between a quarter to a third of people may stop in their progression when we intervene with the right tools, but the rest will still progress, but hopefully at a slower rate. And so the overall stats seem to suggest we're able to get a 50 to 70% slowing of progression in eye length and prescription by using something other than just sight correcting glasses.
Okay. Now, I don't want to get too much into the weeds here, but I understand that with the lenses, like some of the glasses and the brands that are available now for myopia control and contact as well, they kind of work through a mechanism of creating some sort of defocus within the eye. Is that right?
Correct.
Can you explain that for us?
It all comes down to what the optics are doing on the outside of the eye. And so I'm not sure if it's a good time for me to maybe grab a model and I can point at it. So I'll,
if you like,
we'll see if we can make that work. I'll go and grab one. Okay. So if we have a look at the model eye, basically we've got a tiny little spot here called the macula, and that's where we are conscious of whether we're seeing blurred vision or not. And so that's what we're making a decision on whether you can see clearly when we're doing a prescription lens to restore clarity in the distance. But when we have a lens, it's putting an image across the entire back of the eye. And this is the important part, that if we're using a lens that's just designed to make this clear, it puts the wrong kind of optics in the periphery here. Okay. So if we can use a lens that says, okay, we're going to keep this part clear, but we're going to put a different type of focus out in the periphery, then it flicks a switch on the growth mechanism. So we can control how the eyeball changes shape by changing the optics, because the retina is just a bit of brain tissue that we point at things. So it's actually processing what the light's doing. So if we're able to apply a different focus in the middle compared to the outside, that's how we control the growth. And really what kickstarted a lot of it was the ortho-K, which was an accidental finding where we were using ortho-K to restore clarity of sight to adults. I've been wearing them myself for 20 years, just as my choice for being able to see clearly. We used to sort of talk about it as an alternative to laser surgery. It's non-surgical. You're not wearing contacts during the day, et cetera, et cetera. And as we got more comfortable with the fitting techniques and they became easier, we started fitting younger and younger people. We noticed that teenagers and children who were fit with it, anecdotally, the clinicians who were doing this in the early days, we were saying, hey, do you notice these kids aren't progressing like the ones that we are prescribing glasses to? And there was enough of us making enough noise about it that the clinician, that the researchers are then were able to start looking into it. And then they discovered that just one of the sort of side effects of ortho-K is it created this dual focus. And so when they've recreated dual focusing in contact lenses and spectacles now, they're getting a very similar effect in being able to slow down the progression.